Welcome to Living Vividly, the podcast where health, wellness, and curiosity collide. I'm Jackie, the founder of Vivid Health and Wellness, your guide on this journey to living your happiest and healthiest life.
My co-host Daphne, the unconventional dietitian, is always ready to shake things up and bring a fresh perspective to your wellness journey. And we can't forget Dustin, our producer, who keeps everything running smoothly behind the scenes. Together, we'll chat with health and wellness experts along with everyday people who have inspiring stories and practical insights to share. If you're ready to nourish your body, move better, and discover simple ways to thrive, you're in the right place. And hey, if you enjoyed today's conversation, don't forget to leave us a comment sharing your thoughts, and subscribe so you never miss an episode.
Welcome, Jessica Welch.
Thank you. I'm so excited to be here.
We're going to talk about hyperbarics today.
Yes,
is it hyperbaric or hyperbarics?
Hyperbarics.
Okay.
Hyperbaric oxygen therapy, hyperbaric chamber. It has lots of
Not to be confused with bariatric.
Not to be confused with bariatric.
or hyperbolic.
Right.
I hear a lot of different. It's a mouthful.
So what is hyperbaric?
So
oxygen.
technically it's hyperbaric oxygen therapy.
therapy.
Like that's
Yeah.
the whole
HBOT.
Yeah, depending on how you use it, and so
Okay.
that's another thing we can go into. Some people use oxygen, some people don't. But
Ooh,
hyperbarics.
tell us more. Okay.
Hyperbarics, when it first started, first of all, a lot of people don't realize that this started way back. The first hyperbaric chamber is like way back in the 1800s.
Really? Okay.
Yeah, or a hyperbaric environment. And hyper means increased, and baric just means pressure. So a higher pressure environment, which is what we create in the chamber. But hyperbarics actually started back in the 1800s. They were using it for respiratory issues and things like that. And it really kind of came into the world of medicine with diving medicine. So divers who were working on bridges and things like that.
Okay.
Would experience something called the bends, which is when you come up from pressure too fast because of certain laws of physics. Gases expand and shrink. And when they come up too fast, they don't have enough time to come out from the body, and they get stuck in the joints, and it's really painful. So that's kind of how it first got its use. And really what's cool is these divers are being treated for that. And they started noticing all kinds of things resolving and getting improvement in things like headaches or really fast healing from wounds. And so that's kind of how it started to be used for other things other than carbon.
So it's hyperbaric is increased pressure. So in the chamber, that's what you call it, right?
Yeah.
Chamber. It's a it kind of looks like an old-fashioned tanning bed.
Yeah.
I mean, to give you like
Yeah,
a
it does.
visual, where you get in it and it closes on you and you're laying down.
Yeah.
Your whole entire body is laying down.
Right.
In it.
It's a contained environment without any breaks in the seal because you need to increase the pressure. And that is a common misperception. A lot of people will come in and they're like, this was fantastic. I'm going to go buy an oxygen concentrator, get my little nasal cannula, and I'm going to be set at home. Well, it doesn't really work that way. That's one of the pieces that I have to educate on a lot. Because how hyperbarics actually works is we're changing the laws of physics when it comes to gases. So there's a law called Boyle's law that when you increase pressure, you're able to then dissolve a gas into a liquid. And how that applies to the body is that you and me sitting right here, if you're healthy, and I'll put like the little oxygen saturation monitor on you, you'd probably be at 98 to 100%. So if I then put a little nasal cannula on you and you breathe oxygen, you can only get to 100%. You can't get more than 100%. And that 100% means your little hemoglobin molecule on your red blood cell is fully saturated, and you can't get more than that.
Okay.
But in the human blood, you have your blood cells. Red blood cells carry oxygen, and your plasma doesn't carry oxygen, or it does, but it's like 3%.
Minimal.
For all intents and purposes, it doesn't really carry oxygen. But when you change the laws of physics in the chamber, the liquid part of your blood,
Which is the plasma.
okay, you put it under pressure, and now you can dissolve a gas into that. And it becomes a second delivery mechanism. And that's really where the magic happens, because now you've got two oxygen delivery mechanisms. And the other thing is that red blood cells are kind of big and clumpy. And as our blood vessels turn into capillary, they get really, really narrow. And it's much easier for that plasma to seep into that area and go deeper into the tissues than those big clunky red blood cells. So kind of like two mechanisms, you're doubling your oxygen carrying capacity. And also because it's liquid, it can get deeper into those like nooks and crannies where when you have an injury, oftentimes that capillary bed is damaged. And so you're not getting oxygen into those areas.
Very cool.
That explains it so much better than what I was envisioning earlier.
It's a little bit sciencey, and like physics is not my background. So when I first started this, I was just like, wait, I thought it just helped with wounds. Like that's like beyond my, but you know.
That makes more sense when you can understand the red blood cells and the plasma, that combination, because plasma getting into the very, very small areas that can oxygenate those areas makes so much more sense. Yeah. So we're talking about oxygenation of like the brain, of any type of wounds.
Yeah. And so one of the other first uses, primary uses, and most well-known uses is for like limb salvage or like non-healing wounds. And that's because oftentimes with an injury or a wound, you damage that capillary bed, and you also secondarily have inflammation, which will press on those capillary beds. So it makes it really hard to bring all those healing factors to the area. And so when you take like a wound, you asked about the brain. A brain injury is really just a wound when you think about it. Yeah, it's particularly great for getting into those nooks and crannies of the brain where those capillary beds are also damaged. So
very cool. Tell us a little bit about what got you into this.
Yeah, so I'm a nurse. I'm an RN. My path to opening the clinic that I have now was kind of like a long and meandering path, but I'm also a rolfer. And so that type of work, which is the type of physical body work, it's very physical, very demanding on the body. And it was about 2018. My daughter was about a year and a half, and she was a chunky little baby, and she was crawling somewhere. I was sitting on my couch, and I went to grab her, and it was just one of these things. Grabbed her just in the wrong way, and I felt a pop in my back, and then the most excruciating pain I'd ever felt. Got some imaging and found out that I'd bulged 2 discs and torn one, and it put me on my back for quite a while. And I went through doing physical therapy and had a pretty good recovery, but I was still struggling, was still limited. I have 3 kids, and I wanted to be on the ground with them, playing with them, wrestling with them. And I just knew there had to be more healing that could be done. And I couldn't go the route of medication.
Right.
I knew that just wasn't the route that I wanted to go. And so I started digging in. I love research. I love science. I like to get to the but why? As I was sharing with people why I wasn't working, they were like, oh yeah, I have a back injury too, or I have a back injury too. That's why I don't play tennis. That's why I don't. And so I started asking the question, why do back injuries become so chronic? And so that kind of started the thought process. And what I landed on, and I asked my physical therapist, did you know that a back injury can take on average, it takes about 365 days to heal that disc. And the reason for that is because the vascular supply is so poor to the disc.
By vascular, you mean blood? Just
the blood flow.
Supply.
Yeah. The blood flow, I'm sorry. The blood flow to the disc is really poor. That's why like a bone will heal so much faster than like a tendon, ligament. And the discs are like one of the worst as far as like healing times go. In my mind, I thought, well, there's got to be a way to is there a way to reverse engineer that? Is there a way to increase blood flow to my disc? So that was the question I got on my computer and was starting to research, how do you increase blood flow in the body? And hyperbaric started popping up on some of these kind of fringe.
Yeah. How long ago was this?
That was 2018.
Okay.
2018. Yeah. I had heard about actually through Jackie. There was somebody here in town that was doing
Different Jackie.
The other Jackie.
Yeah, sorry.
My other Jackie.
She comes up a lot on this podcast. We need to interview her.
Yeah, she's phenomenal. She's just an amazing gal and always on the cutting edge of things that are up and coming and new and in the holistic realm. And so anyway, I remember her mentioning it. I was like, oh yeah, okay, I'm kind of familiar with that and all the good things I heard her talk about it for. In hyperbarics, we oftentimes don't say we're treating anything. We like to say that it treats nothing and it helps everything. And that's because there are about 10 what we call mechanisms of action. And one of the big ones is it stimulates something called angiogenesis, which is just a big word for the formation of new blood vessels. It stimulates this process. And I thought, okay, if the problem is poor blood flow and this stimulates new blood vessels, maybe if we superimpose my problem with the benefit of hyperbarics, maybe it'll work. Shortly after that, it was a tough little patch in my life. Shortly after that, my 4-year-old, who has a little sensory processing disorder, which makes him more sensitive to sound, the way his brain interprets where his body is in space, sound, sight, all your senses. He's a little more sensitive. His reaction is different. So he was already a little bit what we call sparky.
Well, plus he's 4 years old.
Plus he's 4.
Yeah. So he's still just learning his body anyway.
Yes. And so he was out playing with his brother one day, and because of this sensory processing disorder, he's not real aware of how fast or hard he goes oftentimes. And he was charging after his brother, didn't see a tennis net, and had the back of his head slammed down on a hard court and suffered a massive concussion. He had amnesia of the whole event. It was very scary. And I remember being in the ER and, he was scared and it was scary to me. He couldn't remember what he did. So I knew just how damaged his brain was. In the coming days, he was very symptomatic. This is my all or nothing kid. He knows one speed. And they basically sent us home saying, put him in a dark room and wait and see. And that just wasn't good enough. Now I get teary.
There's nothing like a mom who's determined to find a better answer.
With brain injuries, what oftentimes happens is you also get, it's this thing called the microglial activation. Basically what it does is it creates a lot of inflammation in the brain. And one of the beautiful things about hyperbarics and why it's so beneficial for autoimmune disease, for injuries, for mold, is because it has an influence on something called cytokines. Probably heard about that with COVID, with the cytokine storm.
Right.
And it's pro-inflammatory. It's pro-inflammatory and inflammatory. Anyway, hyperbarics turns up the anti-inflammatory cytokines and turns down the pro-inflammatory cytokines.
Okay.
So you think about that and apply it across a number of diseases, any disease that has inflammation as a part of its pathophysiology.
Which is basically what disease is.
Yeah.
It's an inflammatory process of some sort.
Yeah.
Every disease.
And even just for people who are relatively healthy and looking to get healthier, lowering inflammation is one of the best things you could do.
Right.
I started talking to my husband about this. I was like, I've been researching. It seems, here's the science on why I think it'll help me, why I think it'll help Solomon. And then, part of my practice was doing the body work, the type of structural integration, Rolfing. And I was like, well, I wonder if any of my injured clients would be interested in doing this, because it's known for wound care.
Right.
Going back to the mechanisms of action, it stimulates fibroblasts, which make your connective tissue. So it stimulates that and collagen production. So I'm like, it'll help speed up wound healing, increase blood flow to the area, lower inflammation. These seem like good things that could help an injury. So I'm like, maybe some of my clients will let me throw them in this thing. And that's and that's how I convinced my husband to let me invest. because they're not cheap. But it seemed like at the bare minimum, maybe it would help me and my son, and perhaps I could turn it into a business. And so we did. It did. And that's kind of how it all got started.
How is your son doing?
He's doing amazing. Okay. I mean, to look at him, you wouldn't even know. Straight A student, doing great. Yeah. So,
and how old is he now?
He's now 11.
Wow.
Yeah.
Very cool.
Yeah. And does he still use it?
He does. He does. And he actually, kids are so great because they have no filter. So if you really want to know if something's working,
you get him on the podcast.
He would be, if you want entertainment, this guy's got jokes for days. He is like, unlike anything else. He loves it. And he'll actually, because sensory processing disorder doesn't go away.
Right.
You just kind of adapt and you optimize the brain as much as you can.
Yeah.
And so he'll even notice sometimes if he's been overstimulated, and he plays football. I said a prayer whenever I found out I was pregnant with boys. Let's do anything we can to not have them play football. But of course, they love it. And so.
Yeah.
You can't think about football while you're pregnant and have them not play football.
It's all those Saints games that I watched while I was pregnant. Anyway, yeah, he'll still ask for it when he's been overstimulated or if he's taken a spill. Again, he's very, I hate to use the word clumsy, but he's very clumsy. And so he broke his ankle twice last year.
Oh my goodness.
We threw him in there for that. So yeah, he'll still ask, especially if he gets injured and he wants to get back on the field, but he'll ask just for his brain. He'll notice when he's having a hard time filtering out what he's saying, getting in trouble a lot. Or if he's really sensitive to red dye, if he's like around Christmas time, pounding candy canes and whatnot, he'll notice it and he'll ask to get in. But yeah.
That's fantastic.
So it sounds like it's obviously not a one-time thing. So what would a protocol be to get somebody in there, to get someone to, I mean, I know this is a very broad question, but to see some kind of change because, if we go back to medicine, if I'm sick and I go to the doctor and they give me antibiotics, it's a one-time thing. It lasts, 7 to 14 days. I'm better. That's not how literally anything else in the functional healing world works. So what would a process look like or a protocol look like to get somebody to where they're feeling better and it's really creating change in their inflammatory process?
With hyperbarics, there's certain effects you'll get immediately, right?
Okay.
So immediately you're reversing areas of hypoxia.
And hypoxia meaning
low
you don't have enough
oxygen
oxygen.
state. If you don't have oxygen is like a key ingredient for something, again, tell me if this gets way too sciencey, of something called ATP, which is your body's energy currency. So it's like a car. You can have a Porsche sitting in your driveway, but if it doesn't have gas in it, it's not going anywhere.
Right.
Same thing with our body. If we don't have enough of that ATP, we're not going anywhere. We're not going to be able to function well. And oxygen is one of the rate limiting steps in it. So without oxygen, you can't generate enough ATP. So that's one of the immediate benefits you get is you get an increase in oxygen. So an increase in cellular energy. So a lot of times people will come out and feel more energized. And that's one of the reasons why people will do it just for generalized health is because when you have more energy to your liver functions better. More energy to your brain functions better. So whatever area you're having an oxygen deficit in, it immediately reverses that. But there are other benefits that happen after multiple exposures. And the reason for that is when you get in the hyperbaric chamber, one of the ways that it works, when you get in the hyperbaric chamber, yes, you're doubling that oxygen carrying capacity. But a cool thing happens when you get out of the chamber. Actually, your body perceives that because you were at such a high oxygen state. When you get out, your body actually thinks you're hypoxic. And so our bodies and its infinite wisdom says, oh crap, we're hypoxic. What are we going to do about this? So it goes throughout the body and says, what can we do to survive hypoxia? So it says, let's form some new blood vessels. Let's stimulate stem cells. Let's turn on our body's endogenous antioxidant system. Let's generate more cellular energy. And it does all this with repeated exposure. Because if you do it one time, your body's kind of like, after a little while, it's like, oh no, we're fine. We're not hypoxic.
Yeah.
But with the repeated exposure, your body really thinks it's in a crisis. So it upregulates a lot of its healing.
So it kind of becomes accustomed to having that excessive amount of oxygen in comparison to normal. So it's trying to strive to get to that point.
Yeah.
Very cool.
Basically.
Our bodies are so incredible how they just self-heal.
I mean,
When really given the right environment.
and I think that's what really drew me to hyperbarics too, is my mom was kind of one of those OG hippies, health fanatics. She was always fascinated with it. Yeah, she was sprinkling acidophilus on my food. She was like doing these weird things before. So that was kind of like my background. And I've always really tried to maintain my health. I was always interested in how to be healthy, optimize my health. And hyperbarics, really what I love is we're not really introducing anything into the body. Mm-hmm. We're just tapping in and kind of tapping the body on the shoulder and saying, hey, wouldn't you like to stimulate this and this and this? That's helpful. Yeah. And the body really does the rest. So yeah, it definitely is tapping into the body's innate ability to heal itself. And that's kind of my jam. So hyperbarics was one of the things that moved the needle the most. I also think when you sustain an injury like that, and then following that up with my son's injury, my nervous system, I was just like crawling up the walls. My nervous system was wrecked. And going back to that boring phrase, the mechanism of action, one really cool thing, and this is why one of the patient populations I really like are mothers and women, because there's just so much of a demand on us. Mm-hmm. We try to do it all. And most of the women I know, I don't know about y'all, we are just like so stressed out, so maxed out, so overextended, that it's really a population that I love serving. And it's something that I didn't know I was going to get a benefit. I certainly wasn't seeking out hyperbarics to help with that. I was seeing my therapist for that. But again, as I kept digging into the science, there's something called your vagus nerve. It goes from the brain to the gut and is part of our parasympathetic nervous system, which is like the opposite of fight or flight mode. Without knowing, I was getting in there and helping my nervous system, which helps the whole terrain of the body be more receptive to healing. And so,
well, also it sounds like, I mean, the treatment is about an hour, right? Mm-hmm. So you're actually you don't have a choice. You have to pause for an hour and just be,
which I
just
think
lay there.
Is half of the medicine of it.
I would say so.
Because, I mean, what woman do you know does a protocol of rest? You know?
I don't think I've ever laid down for an hour with,
isn't it?
Like not feeling guilt, not thinking about something else that I needed to do. When I did the hyperbaric chamber a couple weeks ago, like you're locked in there. There's nothing else I can do but take a chill.
And I think like too, at least for me, if I'm in my house and I just lay down on my couch, I'm thinking about the laundry. I'm thinking about projects I can get ahead on. But there's something about when you're out of your house and you're locked in, committed, something in your body just goes, okay, I guess we're doing this.
Well, you're still doing something, you know, so you're not really just resting. You're still doing something. Yeah. So there's a positive part of that too.
I agree. But I totally feel like there's a lot of benefit behind the science of hyperbarics. But truly, I think just scheduling that hour of rest for many women and men who are handling it all, not to leave the men out, but you know,
what if we're claustrophobic?
If you're claustrophobic, that's real. And that is something that we deal with.
It is entirely closed in, though. That's what I'm trying to.
Entirely closed in.
But there's a little window.
There's a window, and you can see out. And I'm right there talking to you. I'm watching you the whole time. And it's really spacious. The one that I have is
So it's not like a cocoon.
No, a lot of people, what I hear the most frequently is people are like, I don't do well with MRIs. I'm not going to be able to do this. It's not at all like that. First of all, you can move around. There's lots of space. I could even sit up in it.
Well, and you've said that you can have 2 people in there. I mean, it's big enough to have 2 like smaller people or an adult and child.
Well, and so when Solomon first started doing it, we dove together. We would do our dives together. But it's really spacious. And so what I do with my clients who are like, I don't know if I'm going to be able to do this, is I have them just first come in and we try to kind of like desensitize them. So we have them come in. First, they just say hello to it and we talk. And then they can come in, they can hop in, we leave it open, and then they can come in, we put them in for 5 minutes, decompress. But honestly, I've only had to do that with like a handful of people over the last 6 years. And I've only had 2 people, and one had PTSD, that weren't able to eventually go all the way through with the treatment. And part of that is because that vagus nerve stimulation, if you can get in there and be in there for a few minutes, that kicks on. And oftentimes they'll
just
conk
kind of
out, take a nap,
and
see him snoring.
So I think the other question I really have is, does this take place of all the other things that do what this does? Like we've talked about many ways to stimulate the vagus nerve, talked about many ways to decrease inflammation. Could this just replace all of those ways? Or is this like an in addition to thing?
So I think you've got to get down to what's your illness, what's your injury, what's your issue you're dealing with. If your appendix is rupturing, you're not going to get
straight in the chamber.
Right in the chamber, right? No, if your appendix is rupturing, obviously you need surgery because that's what's going to reverse what's
the problem.
Right. So would it replace... I guess that's where the practice of medicine comes in. You got to look at what your root cause is and then kind of superimpose what is the answer, like the puzzle piece that fits for the problem with the solution.
I mean, you're like supplying the body with so much oxygen and it's doing so much for it. But if you leave there and go eat super inflammatory food and
lay on the couch all day.
Do all these opposite activities to counter.
It's like pouring gasoline on the fire while you're trying to extinguish it.
Right.
I mean, you're not going to get very far with that.
I think all of the healing modalities really kind of have to support one another. Like, do you need every single one of them? Maybe not for every situation, but anytime that I don't know that there's one that replaces everything else. It's always to support the way that the body is functioning, the way our body innately heals itself.
Right. And I think it just kind of depends on, like, for instance, with my back injury, could I have done just hyperbarics and healed? Possibly. But why would you want to not do massage and physical therapy? Because you're approaching it from different angles and addressing the different things that are contributing to why you're experiencing what you're experiencing.
That's cool.
One thing we didn't talk about yet is the mild hyperbaric that you do versus the hospital grade. Is that kind of the terminology?
Yeah. This is something I get asked a lot. What's the difference between high pressure, low pressure, mild, soft? And the language, because we're just now expanding out to use hyperbarics for wellness and for certain conditions that are not insurance approved, that are considered off-label. Basically, the difference is you can go at various pressures, and more is not always better. And this is one thing, I think across the board, we usually think if a little is good, more is better. And that's
of course.
Right.
Why not?
More is not always better. And there's a couple of reasons why. One, if you too much oxygen can also, and we're talking about really high levels, 100% green tank oxygen, 3 atmospheres, can create some oxygen toxicity. That never happens at the mild, lower pressures. And there's signs and symptoms of it, and you can monitor for that, and you can decompress, and then it stops. But the the main difference is the amount of pressure. And scientists used to think that the higher pressure was better, but there is a landmark study that actually just came out where they measured several markers in the body, certain genes and certain cytokines in the body, because there was this argument of which is better, higher or lower pressure. And what they found is what they theorized was that low pressure, they knew low pressure did something and they knew high pressure did something. And they thought it was theorized that the low pressure would do what the high pressure did. It would just do it slower. And that's not at all what they found out. And it was really surprising and really exciting. And what they found out is it was more like kind of like a Venn diagram where there were things that mild hyperbarics did that high pressure hyperbarics did not do. And then there were things that high pressure hyperbarics did and low pressure did not do. And it's in the middle, there was some crossover. This is something that even people who are in hyperbarics may not be aware of. Like I said, it literally was done. The study was done about a year ago and they just published it. So it's one of the things we were talking about at the conference is, and it's going to be a challenge because most people are not going to do genetic testing to find out which pressure they need. So then it's just, what do you have the financial capability to
access to?
And really what I tell people is just try both. See which works for you. I'm not team mild or team high pressure, except for maybe with brain injuries, because as you increase oxygenation and pressure, we tend to vasoconstrict. So with brains, because that fragile capillary bed, typically low and slow is what the doctors usually recommend.
Right.
And then there's other conditions that low and slow is better, like with Lyme disease. Lyme disease, as you're healing, as you're eliminating what's causing it, there's a die-off reaction. Response called a Herx reaction. And if you push it too fast, sometimes the body can't process it well, and it can be too much. So with my Lyme disease, people, we like to go low and slow too, but both are beneficial. It just higher pressure usually costs a little more because the machine costs more, and lower pressure is a little bit more affordable. There's so many benefits. I don't know anybody who couldn't benefit from more cellular energy and, new mitochondria, mitochondrial biogenesis, or the immune support. It just has so many benefits.
So your clinic is Acadiana Hyperbarics. And what else? Obviously you do hyperbarics there, but what other kind of things do you have in your clinic?
Basically, as I mentioned before I got into hyperbarics, I was doing this type of body work called structural integration or rolfing. And so I still do that some. I don't do it as often or as much, but we do have a massage therapist in our office, and she does massage therapy, lymphatic drainage. We also have an infrared sauna. We do red light therapy. We have something called brain tap, which I use a lot with my brain injury clients. And then we have a small supplement storefront.
And you do yoga, right?
Yes. And we do yoga too. We have a small yoga practice in the back.
Daphne and I accidentally walked into the yoga studio. And we were like, I don't think we're the right place. I don't know where we are. Got a pillow.
Jumped into the a vinyasa or something.
Very cool. Yeah. And so what would, we talked about kind of what the protocol would look like, but what are specific disease processes that you would work with for hyperbarics?
Some of the things, as I said, there's a wide array of conditions that it can be beneficial.
What do you most commonly see?
I see a lot of brain injuries, stroke recovery. I see a lot of autoimmune disease. Again,
just kind of across the board autoimmune disease. Okay.
I see a lot of fibromyalgia. I work with a lot of athletes with their injuries and getting back onto the field. I'm a mom, and I talk to a lot of my kids' parents and moms. And, when I start talking about it's weird what I do. It's a chamber. I'm putting people in a chamber with oxygen for various reasons. And so they're like, I get a lot of questions and I tell them why I do it, why I continue to do it, even though my back feels pretty darn good.
Yeah.
And they're like, oh man,
I could use that. Yeah.
And look, if you go back to the collagen synthesis and, it's really great for anti-aging, just for superficial reasons. It's a great anti-aging tool that's natural. And so, there's a wide net and a diverse population that I see. But those are some of the major things that I see.
I'm going to get my daughter in there. She has celiac.
Yeah. Well, it's really, really good for IBS Crohn's because it stimulates stem cells for the gut lining. So it really helps with like gut permeability too.
And very so cool. You cannot bring drinks in there, right?
You actually can.
Oh, okay.
And that's something that we do with some of our another population of patients that we see is autistic children that are on the spectrum, to calm that neuroinflammation and to help heal whatever to stimulate brain healing and brain optimization. And so sometimes the young kids can't quite understand how to clear your ears because that's one thing you have to do because it feels about like it would feel on an airplane.
That's why I was thinking that.
Yeah. So you have to be able to somehow get across that they need to equalize their ears. And one great way to do it is just have them sip on a little bit of water.
Well, thank you for coming. Before we let you go, we always ask our guests one last question, and it's, what does living vividly mean to you?
Oh, that's a good question. I guess as it pertains to health and wellness, I would say that living vividly is feeling your best in your body so you can do your passions, your soul's work, sharing your God-given gifts and making the world a better place.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.